Dr. Hotze, welcome to the show.
Glad to be in this morning.
Happy Monday.
Glad to be up. It's election day.
Early voting.
Yes, sir. Starts today.
On your mark. Get set.
Let's go.
Let's go. Here's a 26-year-old actress checked herself into treatment. I didn't know you went to treatment as she's battling postpartum depression. So women go into almost like rehab?
Well, let's talk about postpartum depression and what causes it. Of course, depression is when a person emotionally feels down and discouraged and despondent for either good reasons or bad reasons or no reasons. And this is not an uncommon problem for women after they have children to get the postpartum blues. Mm-hmm. If it lasts longer than, a week or so, they start calling it the postpartum depression. And it's what causes it? Well, it's the change of hormones that causes it. Women during pregnancy have huge amounts of hormones in their body that are produced by the baby's placenta, primarily the hormone progesterone. Progesterone, which means promoting gestation or promoting pregnancy. Women make that when they're not pregnant. In a normal menstrual cycle, a woman will make estrogen hormones for, let's say, a 28-day cycle. Day one's the first day of the period. She'll make estrogen. When she ovulates in the middle of the month, she'll make progesterone. And they balance one another out, and they prepare the inner lining of the womb for a pregnancy. If there's no pregnancy, hormone levels fall. They slough the inner lining of the womb, have a period, and then it all starts over again. When a woman becomes pregnant, she continues to make progesterone to promote the new developing baby. And then by about 3 or 4 months, the baby's placenta kicks in and makes all the progesterone. So she has huge amounts of progesterone that are being made, promoting that gestation by the baby's placenta. Now the baby's delivered. Then the placenta is delivered, and there's a precipitous drop in progesterone. Progesterone, by the way, also enhances thyroid hormone function, which governs the body's metabolism. So there's this precipitous drop in hormones. The ovaries have been shut off because the baby's placenta is making the hormones. Now you got to turn the switch back on the ovaries, and sometimes they don't turn on too well. So about 10 to 20% of women, and there are about 4 million pregnancies a year, so 200,000 or 400,000 women a year get the postpartum blues and then maybe get postpartum depression. Well, what do most conventional doctors do? Let me ask you, what would you do if your tank of gas was falling lower and lower and lower, and the car or your oil was getting lower and lower, and the car wasn't running well? What would you do?
Go to the gas station.
Yeah, and fill it up. Okay, so the hormone. Hey. You get it.
Dude, I'm a doctor. Look at that.
Look, I'm telling you. So the hormone levels fall, progesterone levels fall, thyroid doesn't work as well. What would be the common sense thing to do? I haven't even prepped you on this. What do you think you ought to put back in the tank?
Whatever you lost.
Right, the progesterone. So you get progesterone hormones, and that helps ease a woman back into her normal cycles, and it helps her, and maybe you give her a little bit of thyroid. Listen, I've got 5 daughters. They have had among them, they're on their 23rd pregnancy. I have two of my daughters and daughter-in-law, and I have 5 daughters and 2 daughter-in-laws. So that we have 21 grandkids so far, 2 in the hopper. And there has not one of them has had any postpartum blues or depression because I make sure they have progesterone the day after they deliver that baby. They start on progesterone.
Well, let me ask you, Dr. Steve Hotze, Hotze Health and Wellness. Don't the docs tell them this?
Here's what they do.
Don't they prepare you for this?
Sir, this is what they do. Unfortunately, conventional doctors put them on antidepressants as if their problem was low levels of Prozac. Well, they never had Prozac in their body. They're not feeling blue because they have low levels of Prozac. The hormones affect brain function and the neurotransmitters in the brain. You simply have to replenish the hormones. So I want to encourage any of you ladies out there that have daughters that are pregnant or any of you ladies that are pregnant, the best way to prevent postpartum depression is to make sure that you take natural progesterone immediately the day after you deliver that baby. You start on that progesterone. You may need a little bit of thyroid. And this is what we do at the Hotze Health and Wellness Center. We help people overcome their problems by treating the underlying cause of the problem, not medicating them with a bunch of psychotropic drugs, the antidepressants and the anti-anxiety medication.
Amazing. Hayden Panettiere from Nashville it said in the story there, Doc, voluntarily seeking professional
Yeah,
help.
and they're going to put. I don't know if we have time, but Maggie came from St. Louis. Her husband brought her down. She had a baby. She was laid up in bed. She was depressed. She was tired. They put her on antidepressants. She couldn't function. This went on for a year. He brings her in from St. Louis. He was in seminary there. Brought her in. She was a friend of my daughter's, and my daughter was living in St. Louis, and she came in. Maggie came in, and we got her off her antidepressants, put her on natural progesterone or natural hormones and thyroid. Hey, she's doing great now. This is 8 or 10 years later. No, it's got to be at least 10 years later. She's had 2 additional kids and doing great. But they had her bedridden on antidepressants. And there are women out there right now that are bedridden on antidepressants. They won't get well until they get their hormones balanced naturally.
You would think, Doc, we got 60 seconds, Doc, but you would think that, and I'm not a doctor, if you give somebody antidepressants, but the problem is over here in progesterone, you're not fixing it.
You're not fixing the problem at all.
You put a bad Band-Aid
Well, a
on
bad Band-Aid that can cause more problems. It really can, and ruin marriages and ruin lives.
That's amazing. Hotze Health and Wellness. Hotze is Hotze. He's a great friend. He's my role model. I call him the general. I love when I feel better when Dr. Hotze's here.
I call you the general, sir.
I'm thrilled to be a command sergeant major, and you're a man any day. I'm not an officer. Hotze Health and Wellness right off of I-10. Go visit them.